Hello everybody, this is Dr. Nicola Ducharme speaking, the Naturopathic Mama. How are you today? So I wanted to come here and give you some information on a potential new treatment in chronic Lyme disease. And this medication is getting a lot of attention. There's a lot of buzz floating around the internet. You're potentially reading and hearing about it already. And it's a very new treatment. However, it is showing some good promise in the treatment of chronic Lyme. And that treatment is a medication called disulfiram. So before I get into that, I just would sort of set the context here by saying that we know that chronic Lyme is challenging. We know that there is a lot of controversy around treatment. We know that there is no one thing that works for everybody. And we know that there is no magic bullet. Okay, so I'm just trying to be realistic here. And I think it's very important as we explore this new treatment that we stay really balanced in our view of it. There's no one thing that's just going to be the magic. I wish there was. Trust me, I wish there was. But the reality is that some people respond to something, some people respond to others, some people can tolerate medication, some people can't, some people get massive Herx reactions, some people don't. And so we need to proceed really cautiously as we explore this. And at the same time, Lyme is hard to treat, it's stubborn. And so when we get a new treatment, a new medication, a new herbal remedy, a new neural retraining program, whatever the case may be, if it's working for some people, it's definitely worth exploring. So let's get in and just kind of outline what we know so far. And I'll recap it. And I'm also going to be posting a blog post about this later on today. And I also wanted to invite you guys to a webinar that I'm going to hold in a couple of weeks that actually talks about this and a couple of other things that I'm seeing working really well in my practice. So I'll wrap that up at the end. I'll post the link for the webinar in the comments after this. So for right now, let's just go ahead and talk about the disulfiram and kind of the information that we have to date. So this was published recently by Dr. Kindler, who posted a lot of information about it. But the person I'm really kind of in touch with more closely right now is Dr. Kenneth Liegner. He's a MD on the East Coast, and he's been doing this treatment with his patients for a couple of years now. And he's being very gracious sharing his experience. I'm in contact with him directly through an ILADS forum that's for ILADS members only. And so just trying to learn, as much as I can here. I'll be very honest and upfront with you. This is not something that I've incorporated with my patients yet. There's still a few things that I'm researching about it, but I'm getting a much more clear view. And I am going to be starting to talk to a subset of patients about it. So obviously I'll share more information as I have my own hands-on experience with it. But the bottom line is disulfiram is also called antabuse. It's a medication that has been used to help people avoid alcohol. So it's used in alcoholism. And the reason is, or the mechanism is that it makes you very, very unwell. If you have even the tiniest bit of alcohol, you get raging headaches and hangovers and just horrible situations. So the hope is that that's enough to prevent people from drinking because they don't want that outcome. The way it works is by breaking alcohol down to acetylaldehydes. And so the disulfiram inhibits some of the enzymes in that pathway. So that's why the acetylaldehydes, and then finally it goes on to be converted to acetic acid. But acetylaldehydes are really what are responsible for the headaches and the hangovers when you drink too much. And so with this medication, it brings that effect on with even the tiniest little bit. So that's kind of the background of the medication. What came to light is that medication also seemed to have antimicrobial properties. So they did some research and showed it was effective against certain strains of Staphylococcus, streptococcus, and also Plasmodium, which is the pathogen that causes malaria. And so in looking at that, we don't know the mechanism, how it's actually working against those pathogens, but it does seem to have antimicrobial activity. So that's kind of where the crossover then comes into the Lyme context. So then another study was done that compared 4 medications and how they impacted Borrelia burgdorferi. The medications were doxycycline, ceftriaxone, vancomycin, and the disulfiram. And of those 4, the disulfiram actually was the most effective at reducing the number of bacteria. So doxy's used all the time in Lyme treatment. Ceftriaxone, that's like the IV Rocephin, which is considered one of the stronger medications. Vancomycin is very powerful, has a lot of side effects. I don't personally use it. But you can see that of those 4, the disulfiram functioned the best. And so that's pretty significant. What's even more significant is the culture in the end was sterile. So it also eradicated the persisters. And one of the things we know about Lyme treatment is it's not just as simple as like, oh, we have some bacteria, we'll give an antibiotic or an antimicrobial herb and we'll kill it and then we'll live happily ever after. There are these persister cells that are very, very persistent, and they hang around and they're hard to kill and they're hard to eradicate. And that's part of why, the chronicity of Lyme and part of why it's so hard to get under control long term is because of these persister cells. So that in itself is a huge deal, that it seemed to also eradicate those. The disulfiram is just talking through a few logistics, and I've got more details about this in the blog post, and I've actually posted details about like the dosing schedule and things like that. So make sure to look out for that. And if you are not on our newsletter list, which means you'd get the blog post sent directly to your email, then just jump on the naturopathicmama.com and sign up for the newsletter. And that way, whenever I send a post, it automatically gets sent to you. So what are some of the downsides then of disulfiram? Well, one of them is it can cause some pretty significant Herxheimer reactions. And so I think a few people went straight to full dose of it and just fell on their butt, like it was just way too hard for them. What Dr. Liegner now is encouraging is starting at a pretty low dose once every 3 days and just kind of increasing the dose every couple of weeks. And so that means really easing into it slowly. So say a full dose is like 500 milligrams a day, he's starting people at either 62.5 milligrams or 125 milligrams and just doing that every 3 days for the first couple of weeks, if that's okay, going up from there. So it can cause some pretty powerful Herxheimer reactions. Now, I'm sure some of you are sort of thinking, well, everything causes powerful Herxheimer reactions for me. How bad can it be? This seems to be, generally speaking, worse, a bigger deal than some other medications. Perhaps because it is so effective, but we'll be seeing about that over time. So starting low dose, the majority of people who do disulfiram are not taking other antibiotics at the same time. That was one of the big questions I had up front, because one of my concerns would be, just being very honest with you, is taking people off an antibiotic regimen that may be holding them stable. They've got to build up on the disulfiram so slowly, is there a possibility there for decline during that time? If then the disulfiram doesn't work for them or they don't tolerate, then they've got to kind of go back and play catch up. So it's not, it's not a perfect system here, but this is what we're learning as more doctors take this on and share their information. There are some side effects of disulfiram. Now, this is really interesting because in some places you read, oh, it's very safe, not many side effects, it's all fine. And then in other places you read, this can be pretty heavy going. It can cause some peripheral neuropathy. As with any medication, people are watching liver function and kidney function pretty closely. to try and minimize side effects. And so again, we're still kind of learning that and what this is going to look like. And that's why the conservative dosing in the beginning is probably a good idea, because that minimizes the side effect profile as well. One of the things to note is that people who take this medication cannot have any alcohol. And so most of my Lyme patients anyway are pretty alcohol intolerant. So they're just generally self-avoiding anyway, because they just don't do well with alcohol. However, think about herbal tinctures. Herbal tinctures usually have some alcohol in them. Firstly, because it draws the active ingredients out of the herbs. Secondly, because it's a preservative for the tincture. So even that would be a no-no. And there's workarounds. You can get some tinctures in glycerite preservative. You can get dried herbs. You can do teas. I mean, there are definitely, workarounds for that, but it's just a point of awareness. But I am reading that some people are so intolerant to alcohol, they're having to review everything, like their hair conditioner, their deodorant, that even a little bit of something that has some alcohol in it on their skin is giving them raging headaches. Okay, so that's the whole point of the medication. We've got to remember, come back to that. Its purpose is to make one intolerant to alcohol, but it does seem that sensitivity level is extreme. And we'll have to just see how that plays out over time. If that's really the same for everybody, if some people, maybe they sort of get anxious about it and that perpetuates the problem. We'll just see if that's kind of across the board a thing. But certainly not having any alcohol at all, not having herbal tinctures that have alcohol, those kinds of things, it's very, very important. The other thing I would say is we don't have any human studies yet. We don't even have animal studies on this. Dr. Fallon at Columbia University is planning to do a study. So that's great. We'll have more data. We'll have more information. At this point, it's a little bit more based on the experience of doctors who are using it. And, especially we're leaning a lot on Dr. Liegner because he has been doing it for a couple of years. I feel like I read somewhere, don't quote me on this, but I feel like I read somewhere that Dr. Horowitz has been using it for a year. Can't remember where I read that, but I think I did. So there are doctors starting to use it, and there are patients who are interested in trying it, especially those for whom other antibiotics just haven't worked, or potentially for those who've done antibiotics. And I have a few patients in this category that I, can easily think of, who've done a lot of treatment and who've got to a pretty good point of recovery. But one of two things happens. Either they start to go off their antibiotics and start to backslide, even if they have a good level of health with their antibiotics, or they're just kind of sick and tired of doing so much treatment and doing so many things. Dr. Liegner has expressed that he's not generally utilizing this as a first line treatment. So when he starts working with people, if somebody came to see him as a new patient who hasn't done any treatment yet, he's, if I understand this correctly, not putting people straight on this medication. I do think it's better for people who've done some treatment. The other thing I would point out is about co-infections. And again, it's early days. So that study with the 4 different antibiotics was looking at borrelia specifically. But Plasmodium, that the pathogen that causes that causes malaria, malaria is very similar to Babesia. So there's a fairly high level of confidence that this could cross over and help with Babesia too. The jury is still out on Bartonella. There are some people who have reported sort of Barth-Hurk's symptoms. And so if they're correctly identifying those symptoms with Bartonella for them, then potentially it could have an impact. But we just don't know yet. And so I do know that there are some patients who are continuing on Bartonella-focused antibiotics and then introducing the disulfiram along with it. There are some medications that interact with disulfiram. I don't have the list off the top of my head, but certainly there are some. I know metronidazole was a big one. And I want to say the benzodiazepines, again, don't quote me on that. I should have had the list ready for you. I apologize. But there are some interactions to be aware of. And then, like I said, any health or personal products that have any trace of alcohol would have to be eradicated or, replaced with a no alcohol version. So what else do I know about this to tell you? Like I said, if I start using this with some of my patients, which I suspect I will definitely post updates along the way. I mean, I think the only thing that we can say right now is it's looking cautiously optimistic. Okay. And I'm just a realist. I'm not running around going, oh, we've cured Lyme. It's the magic bullet. I think, anyone who says it's a magic bullet at this stage in the game is probably like overstating it. Hi, you're saying disulfiram was to be used solo. So usually it is, but I have read of some people who are doing it in conjunction with other antibiotics. Ligner is leaning towards doing it as a standalone. But of course, there are different doctors out there doing things differently. For me, I would prefer to do it as a standalone because you just don't know exactly how it's going to interact with other things. And like I said, things like metronidazole would be a no-go anyway. The Bartonella meds are tricky. I've got this sort of 3 or 4 patients that Bartonella is just kicking their butt. And these are the conversations I'm going to be having with Dr. Ligner in the next couple of weeks. He's very available and has been very, very responsive and helpful in the forum that I'm a part of. So I will definitely be asking more questions about that. So that's pretty much what we know at this point. I will update you as I get updates. And like I said, I will be posting a blog post that I will go into a little bit more detail about the dosing and increasing doses and things like this. This does need to be managed by a doctor. Okay, this is not something, obviously it's a prescription medication. This is not something that you would want to just kind of go out and wing it and try it without medical supervision. Partially to check liver and kidney function, partially to just monitor and manage herxes. And all of those kinds of things. So, and even just information, like you don't want to do fermented foods, or like you wouldn't want to do kombucha, for example, because actual proper kombucha, not like, commercial kombucha you buy in the store, actual proper kombucha does have alcohol in it. So there are just some cautions and some things to be aware of. But, I think it does show promise. We need to be open when we see a new treatment like this. We need to be open. We need to explore. We need to be guarded, but, hopeful. But this does show promise. And once they get some human studies, or at least some animal studies, I think they'll get human studies next because Dr. Fallon at Columbia is kind of planning that. Then we'll have a lot more information. And, at this point, I have some patients in my mind that I would like to try this with. Patients where I've been working with them for a long time, so I know their history, I know their background, and obviously I will keep in touch with the docs who are using it more, try and gather as much information as possible. All right, so if there aren't any other questions, if you're watching this as a replay later, just drop me in the comments #replay so that I will come back and make sure and just see if there are any other questions and things like that. So just let me know if you're watching through the replay later on. Okay, so that's it, folks. I think it's kind of exciting. I'm not going to get all, put every patient next week on it because we just don't know enough about the side effects and all of the interactions and those kinds of things yet. But I will be trialing it with some folks. So how do you spell it? I'll put the name of the medication in the comments in the chat so that you can see it there. All right, everyone, have a beautiful, beautiful day. Great to be with you. Happy Friday, and I will see you again really soon.